Thank you very much, Representative, and thank you for your work in being here today. You know, Senator Cassidy, what comes to my mind, above and beyond the discussion we're having, Massachusetts is supposedly one of the progressive states, Louisiana one of the conservative states, and we're hearing the same story, aren't we? We're hearing about decent, hardworking healthcare workers trying to maintain a rotten system based on outrageous greed. We're hearing communities being impacted, whether in Louisiana or Massachusetts, and we're seeing that all over the country. I want to pick up on a point that every one of you made, and that is the spillover impact that the collapse of a healthcare facility has on other facilities in the region. In Vermont, Massachusetts, Louisiana, we're all stressed in healthcare. If a system closes down, if a hospital closes down, it's not like, hey, no problem, other people will pick it up. So maybe just go right down the list. Mayor, do you want to start off? What in your community, what is the impact on other facilities?
Well, definitely the other two facilities in Ouachita Parish are overwhelmed. The ERs are full, the beds are full. So not only are the patients having to wait, but the employees that work there are stressed. They're overwhelmed.
Say a word on that, and maybe somebody else. All of you mentioned this in one way or another. You have decent people. I'm always amazed, I got to tell you. I have had nurses in tears in my office, not worrying about their wages, but brokenhearted that they cannot provide the quality of care they have been trained and want to do. And what I'm hearing from all four of you is you have great workers, stressed out, overwhelmed. Who wants to talk about the impact of what Steward has done on the employees of the various facilities? Anyone want to jump in? Ms. Sprague?
Hi, thank you.
Talk a little bit closer to the mic.
Yeah, the impact for the healthcare workers, nurses, doctors, everybody is you go there, you become, I can speak as a nurse, you want to take care of people, you want to help people. Nobody's working this hard in this situation for any other reason. And when you have, in the emergency department where I worked, you have sick, critical patients and not enough physical people to take care of them all. You have to go to the most emergent situation, which means you know that there's some poor little elderly woman in her bed that's in pain, that's not getting her pain medication, or, incontinent and needs to be cleaned up. And in the back of your head, you know that that needs to be done, but you can't physically get there, and there's not a physical time to do it. And those are the things that keep you up at night, where you're like, oh my God, that poor woman. And it wasn't that you didn't want to, you just physically could not get to it because of the life-threatening things or the urgent things you have to prioritize. And it was everywhere at every level. Everybody was trying to make up for what Steward wasn't putting in and wasn't investing. We had to invest with our own work. And
so I'm hearing that there has been an enormous emotional toll on people who see suffering, who want to address it, and are unable to do so.
Yeah.
Not to mention, one of you mentioned people actually taking money out of their own pockets to buy necessities. Ms. McGinnis, did you want to add to that, or?
Thank you, Senator Sanders. I have spent the past 12 years since we realized, it took us a little bit of time to realize what a bad player Steward was, and I've spent countless hours sitting across the table from Steward at least twice a month at staffing and labor management meetings and saying, this is unsafe, this is untenable, we can't do this. We represent hundreds of nurses who just sometimes struggle to come into work, to put one foot in front of another. It ruins you. A lot of people who used to work full-time, 36 hours a week, cut down their hours now. When people are that stressed, they cut down their hours, and they just don't feel like they can do it anymore. It's the moral injury that occurs when you're unable to do the one and only thing you want to do, and that's to keep patients safe and to take care of the best care that you can of a patient, of all my patients. But for the greed of Steward and in the way they deliberately, and it almost feels malicious, deprive me of my colleagues, my support system, my supplies, my equipment. I'm just worn out.
Thank you. Senator Cassidy?
I would defer to Senator Romney.